she ended up kind of completely getting over one of her recurring troubles by losing weight because she had a lot of conscious issues. But what about a case with someone who can't simply like lose weight or like reconstruct their body image? Like, what if there's like a deeper seated problem that's like not so easy to solve? Like, how would you go about like treating that?
Okay, well, if all of you remember, thank you. And again, coming back to your question, that one of the important things is not only how am I feeling, which matters, but how much is that getting in the way of my being doing what I need to do. If I'm so depressed that I can't study, right? If it's so depressed that I don't want to get up in the morning, it's just so depressed that I'm losing interest in my friends, or my friends are leaving me behind because I'm always saying, no, I'm sorry, I can't go with you. When it starts to get in the way is the time to sort of certainly make it a point of looking into it. And college campuses have students, counseling centers and all that, so there are a lot of resources now, right? And some people, my daughter in college, she was a freshman, and she roomed with a girl who had an eating disorder. You know about eating disorders, anorexia? And this girl had a 3.9 grade point average, right? But she was always thinking about how sad she was feeling, how she couldn't stand it, she wanted to kill herself. And my daughter went to student health for her, right? And then she got some help, and it helped her. So there are degrees of seriousness, and that's what I would like you to take away. There are some degrees to recognize taking care of the ordinary depression. That's one thing. If you notice something you're getting stuck on, find someone to try to help you to solve the problem. If you notice that's really getting in the way, then you get a referral to a mental health professional, which might be a social worker or a psychologist, maybe a psychiatrist, something like this could be psychotherapy, and then maybe medicine. On the other hand, if you go to a primary care doctor, sometimes they'll prescribe medicine pretty quickly, particularly if they think you're in trouble. But they'll probably also refer you to somebody. Does that make sense? Okay, now, with Teresa, if you remember, what was going on inside of her was a lack of self-confidence, right? And avoidance and denial. Okay, so that when she learned to drive a car, I put an exclamation point, how she passed the first time, she sweated out. And I was seeing her regularly at that point too, and I sweated it out with her because she wanted to quit. But I kept encouraging, and her family kept encouraging her, right? When she went for the, when she was in the wedding party, the bride had been her best friend as a freshman in high school. They kept in touch, but she was part of a clique, the friend that she didn't belong to. They were all attractive, they all had money, they all had fancy clothes, and there she was. She was the ugly duckling. And for her to sort of go even for the fitting, the weight was kind of just a part of it. It wasn't. So the interesting thing here is what she was learning to do was to recognize the negative thoughts. I can't do this, I shouldn't do it, they're going to laugh at me, blah, blah. Oh, there I go again. Now, a lot of people learn this just naturally, to talk themselves out of it. Are you familiar with that? You ever do that with yourself? I can't possibly do that. And says, come on, you can do it. Look at that, and you start to smile. See, that's the smile. But there's a feeling goes with that, isn't it? Someone encourages me. But if you don't ask for encouragement, you may not get it. You know? And she was getting lots of encouragement, and she learned. Okay, now, I just, when I wrote this up and sent it to you, I asked for her permission if I could use it, even though her name isn't mentioned. And so I have a follow-up for you that I'll give you just before we're finished. But if she can't, and there's such a thing as a serenity prayer. I just saw it in that church as I walked over here. You know, everybody know the serenity prayer? Anybody who doesn't know it? Okay, who knows it? Come on, someone raise their hand. I saw it. You want to tell us the serenity prayer?
It's God help me to change the things that I can change, to accept the things I can't change, and the wisdom to know the difference. Though I might have gotten the first two backwards.
And why do they call it the serenity prayer?
I presume because that leads to serenity. If you
God
can do
gives
that,
me the serenity to accept and the courage to change the things that I can, and the wisdom to know the difference. And that's something that's an important part of alcoholism, Alcohol Anonymous. On the other hand, a lot of people learn to use that. To sort of give, it's kind of like a reality check. You know, can I really do it, or can I really can't do it? Or is it that I don't want to do it? Huh? Yep. The same daughter, that was at UMass, University of Massachusetts, wanted to go to McGill. Anybody here want to go to McGill for college? It's in Canada. It's in Canada, right? Right, and she wanted to go there, but she was afraid to apply. So we asked her, how would you like to just go to a trip to Toronto, wherever it is in Canada? And so she went on the trip and then applied. There are ways of approaching it out of the corner of your eye if it's hard. Huh? Yeah. Does that get at your question? Yeah. And maybe later on, and when you're looking to change something, you pick something that either is very important to you, that you really need to do, so you're motivated, or something that's relatively easy to do, so you don't have to be very motivated. Huh? If someone that wants to stop smoking, that's not an easy thing to just stop. You may have to do some other things first to prepare yourself for stopping smoking. Yeah. Sorry? Yeah? Okay? Other people? Yeah.
Yes, I'm a little confused about the approach because you began saying that everyone has depression and it becomes really bad because it prevents you from doing the things that you've got to do. So that facade, that ability to will yourself to just pull through it is a good thing.
Yes.
But at the same point, masking your depression could lead to the same types of things that Teresa went through, where she wasn't willing to go out and get that encouragement or to go out and get help until it became a serious problem.
Right.
So how do you draw that line between what you need to just tell yourself you have to live through and when you have to say, now she needs help?
Okay. I know how, that's, most of us, I think, go through something like that. It's a matter of degree, okay? And that when it gets too hard, or when you get tired of it, life doesn't have to be so hard, you know? That may be a time. You don't need it, right? But you kind of need it for your quality of life. Do you guys get into quality of life at all at this level? To be happy. You know, not just to be successful, not just to be functional, not to be good, not to be nice. That's important too. But also to feel good about it. Right? Anybody feel good about your senior year? Anybody feel good?
Yeah.
This is safe. We're getting there, Christian.
That's right.
Yeah, but does that get to your question?
Yeah.
Yeah, but it pays, you know, and if you told everybody, you know, everything that was on your mind, you wouldn't have a lot of friends. You might have more of a therapy group. Right? So there's a value, and I really support that.
Dennis, I would just wonder, and Will, correct me if I'm putting words into your mouth, but did you have in mind when you asked that question, what we talked about in English class with repression, that repression can be adaptive, adaptive or maladaptive,
Yeah, beyond a certain point. It may still work, but you don't like it to work, or it may not work anymore. It can be either way to make that choice.
And the approach to recovery in a situation where you've already gotten yourself into a repressed state of mind, is that more biological or psychiatric? Because there is that aspect that was in the case study, that she had this biological propensity to return to depression, but her issues were more about the way she saw herself.
Okay. So here's the theory as it is right now, and then we'll come back to practice. Okay, is that everybody, it's common, so I'll say everybody knows what it's like to have moods. Not everybody does. Some people are so repressed they have no moods. They're computers. I don't know if you know anybody that are just like that. They really don't seem to have any feelings. I know some people like that. That's a fact. You know, it's unusual, but not totally unusual. Okay, so let me just think for a minute. So genetically, we're going back genetically, that in some families there is some presence of mood disorders. Okay, in Teresa's case, it was her mother, her grandmother, and her father. So she had a loading for that. Okay, so So it generally is seen in the families, maybe more of an uncle, an aunt, grandparent. Some people, I had one patient who had mother and father, grandmother and grandfather on both sides all had bipolar disorder. Guess what she had when she was a teenager? She had a bipolar disorder, right. Right, so but there's that vulnerability. It's a vulnerability. It doesn't mean to say you're going to get depressed. You have that vulnerability. And then depending on life circumstances and what you learn as you're growing up, that you are prepared to deal with life circumstances so that that vulnerability doesn't show. Okay? Okay. Some people that don't have that vulnerability, it typically doesn't get so serious. It generally stays more dysthymic, or it can become more a major depression, but it takes more stress. And stress is one of the factors that make this harder. The more stress, the more likely you are to have this. But everybody does not have that biologic vulnerability. Okay? But all of us, try to learn how to deal with things, including disappointment, frustration, loss. And there are some people who've never had a disappointment. Can you imagine being 40 years old and never having a disappointment? They don't know how to deal with it when they have it. One of my friends was in her 50s. She still had both of her parents and two of her grandparents. She really never had a loss. She says, what's it going to be like when I have a loss? I haven't had the practice. But she knew about it intellectually, but she was going to probably suffer more than someone that had the experience earlier of learning how to deal with it. Yeah, but I'm not sure I've answered your question yet.
Well, there are a lot of levels to my question.
He's a deep man.
Another one would just be, so when you're trying to pinpoint a problem, a vulnerability, as being biological, genetic, is the only way to look at that, to look at the genealogy and say, she probably has
Yes.
one? Or
Yes.
there's no medical test you could do to...
Not yet.
Okay.
Not yet. No, we're at a biochemical level.
Yeah.
Yeah, and those are the theories. And there are some people that say, and this is interesting, some of you may have, what's the word I'm looking for? Know something about optimism? Anybody know anything about optimism?
What context?
The general, so to speak, the virtue of optimism, or the trait of optimistic. What is an optimistic person? How do they think about things? Hey,
Fill up your glass.
that's wonderful. And the fellow who's described this, his name is Seligman. I don't know, have you gotten into
We haven't,
Seligman?
no.
Okay.
Maybe in theology, psychology?
We're not that far ahead yet.
May I?
Sure, please.
Yeah. He's a psychologist who had some other ideas about this than we're talking about. And he studied what he called learned helplessness. That people under certain experiences for a long enough period of time, they have the experience of helplessness, which can generalize. Not just, I'm not good at this, but I'm not good at anything. And he would then be very much interested in how is that related to depression. And he came up with the notion of pessimism. That if you are inclined to be pessimistic, you are more vulnerable, never mind the biology, you are more vulnerable to more serious depression. Because it's harder to get out of it. You're more at risk because you're inclined to say, oh, I can't get out of this, and now I can't get out of this because I can't get out of that, so I may as well kill myself. That doesn't happen overnight. That happens weeks and months and maybe years, but it's a scary stuff. And so he has learned to develop a certain set of exercises so people can develop optimistic skills. Just like the Serenity Prayer, just like there's learned optimism. I'm inclined to be pessimistic, and there I go again. And one of my patients, who's now in the late 50s, is just now learning to recognize that she does it. That she has these negative thoughts that come by and by, and she's had them ever since she was a kid, but they have just now become unrepressed. So she can now look at them and make a choice. I don't want to go there. Which is a little bit like stopping smoking. I don't want to have a smoke. I don't want to think negatively. But I can't stop thinking negatively. I may as well give up. Do you see how it cascades? Right? And hopefully you don't know a lot about that yet in your lives. But gee whiz, there are children I see who know what it's like to be depressed because they have the vulnerability. And the family life. And remember that if her mother and father were both depressed, she had a certain kind of childhood where her brother was a star, I know maybe you have brothers and sisters who are stars, of course you're the